necessary in order to have in place for our kids to be safe. Yesterday, I rolled out 5 metrics that we are going to use, benchmarks, a checklist that we're going to rely upon in order to decide, is it safe for kids to go back to school? And so if you haven't had a minute to look at those, I would encourage you to do that. It's all up on our back to school website, and just have a look at those 5 metrics. I want you to know we are taking this so seriously. Details, every detail we're thinking about. We have a team of experts who've come up with those 5 metrics. So if you're a parent out there, we're going to make sure if we say it's okay to go to school, it's okay to send your kid to school. And if you're a teacher, we're never going to ask you to teach in class unless we know we can make it safe. So with that, I want to open this up and begin this discussion. And I'd like to start with you, Dr. Berman. You have written about the importance of managing risk. You've spent your entire career in thinking about how to manage risk in the public health perspective. But you wrote a piece recently, which I found so compelling, about your own personal experience around how you think about yourself going back into the classroom at Yale this fall, and how you think about managing that risk. So tell us, how do you think about that, and what's going to get you confident that it's okay for you to go back to teach?
Thank you, Governor. I'm happy to share my story. I turned 65 last year, turned 66 this year. And last year was an interesting medical year for me. Other than an appendix, I really had never been ill. And last year, not only did I have a melanoma removed from my skin, but I also had a bout of sepsis that landed me in the hospital here in New Haven for 5 days. And I had a multi-drug resistant E. coli that I probably picked up from foreign travel, given the signature of the genetics of that particular bug. And so that was my body's way of telling me that you're aging. You know, we call it immune senescence. You know, your immune system is not as vigorous as it is for the 3 of you, the commissioners and the governor, who are younger than I am. And that's just normal. That's just part of aging. That's why older people have more cancers and more infections and the like, because our immune systems lose some of the vigor. So it was a humbling experience, a reminder that I need to be careful and watch my health, and just be aware that my immune system is not functioning as vigorously as it used to. So then COVID hits. And I was cautious. I took our governor's advice to stay in residence. I was an early advocate of masks before they were popular. I was trying to push masks, and I thought the physical distancing guidelines made a lot of sense because they were based on evidence. We have airplane and restaurant outbreak studies where you have a bunch of people on an airplane or a bunch of people in a restaurant. You can actually map the risk depending on how close they were to the infected person. So this 6 feet distancing is not arbitrary. This is coming from actually experience in respiratory, viral, and bacterial infection transmission studies. So I've been fastidious. My own grown son is an optometrist, so he sees patients at a very close distance, sort of like the dentists do. And he worked late into the COVID, and then he took about 4 or 5 weeks off, and then he started her up early. Why? Because people need their glaucoma taken care of, and their eyeglass care. So ultimately, I meet with my son in my own home or in his with 6 foot distancing, mask use. I haven't hugged him in 4 months. So I'm mitigating my risk. I'm avoiding being risky. And then I had a choice. Yale said, look, we're opening up. We're going to try to open up safely. But what we're going to do is we're going to try to do this to protect students, to protect staff, protect faculty. And if you are vulnerable, you can teach online. And if you're a vulnerable student, you can learn online. But if you want to come into the classroom, we will adjust the classrooms to permit as much distancing as we possibly can with that 6-foot guidance. We are going to require universal masks, and we are going to require people fastidiously hand hygiene with the hand sanitizers that we will make available. And we're going to try to keep people safe. And if we can't get a teacher physically distanced because of the nature of the classroom, we will use plexiglass to create a bit of a wall that will not be soundproof. You'll be able to see the teacher, you'll be able to hear the teacher, but there will be a plexiglass barrier. And sometimes those shields can be helpful as a quasi plexiglass barrier as well. So we can mitigate our risk. And I just wrote that little editorial that you read to tell that story and say, look, I am not hesitating to go back to school because I think I can manage my risk. I'm not going to drive to excess speed getting there. I'm not going to run any red lights getting there. And I'm going to look both ways when I cross the street to go to my office and back to my classroom. We mitigate risk every single day. We have risk, we take that risk, and we manage it. And I think that we as teachers can substantially manage our risk. I will say one thing, we're going to need your help, Governor, because we're going to need the help of Commissioner Infante Green. We're going to need to have some investments in our schools for some plexiglass, for the masks, for the hand sanitizer. We teachers can't do it all by ourselves. I happen to be at a high consciousness university that's going to make every effort to keep me safe. And I have a lot of confidence, but I know that I'm lucky. I know that I'm privileged. And I know that a public school teacher, in Waverly or in New Haven may not be in quite the same situation. They may be more at the mercy of what their local school board can manage. So we're hoping to have a grand alliance to keep the teachers, the staff, the students as safe as possible, mitigate risk without being paralyzed by the COVID pandemic.
Yeah, thank you. So well said. And by the way, we agree. We agree. We plan to make those investments. We are not going to say, good luck, go back to school the way it was.
Yeah.
Temperature checks and masks and distancing and air filtration, the whole thing. So Courtney, you've been doing this. For 2 months, we've had thousands of our littlest kids in childcare, over 1,000 teachers teaching these kids. How's it going?
Thanks, Gov, and thanks, Commissioner, for having me. It's going great. It is hard, and like you both know, all things in COVID are harder than you could ever imagine, and it is to the credit of the team of people that work for me and the heroic childcare workforce who have realized that they are essential employees in our state that allow working families to go be prouder of our results. We have 3/4 of our childcare system open and running safely. We also were able to open summer camp. As moms, we know it's really important to give kids summer experiences, and we knew that kids were suffering. And so to see kids safely playing outside with masks on and pods has just been amazing. And really a testament, I think, to what Dr. Berman just said, that if you do the work to mitigate the risk, all things are possible. We just have to be prepared to roll up our sleeves and to learn from experts and to move forward together.
I think you're on mute, Angelica. Okay, she's struggling, so I'm gonna keep going. I want to go back to you, Dr. Berman. You have, as a pediatrician, you have written recently and in the past about how important it is for children to be in school, in person in school, and the benefits that are achieved from that in-person experience overall. We have a lot of parents out there who are just saying, I don't know what to do. I want to do the right thing for my children. Can you talk to them now and explain, how you would think about
I'd be happy to share my thoughts. So here's a statistic. 45% of people in the United States are under the age of 35. 45% under the age of 35. Less than 1% of the deaths from COVID were in that age group. In fact, it was 0.7%, so 0.75%. So the reality is we have studies from Italy, studies from the United States, studies from China. By total coincidence this morning, I got sent by a medical journal yet another study from China that they've asked me to review, and I skim read it, and it confirms what the other studies say. So there's something funny about the novel coronavirus. The childhood immune system does not overreact the way that the elderly immune system does. You don't get this cytokine storm. There is a condition that resembles what we call Kawasaki disease, which is an inflammatory response. That's a dysfunctional immune response, but it is happily very rare. And we haven't had any deaths from it, to my knowledge, to date. And it's manageable because we've learned over the last 30 years how to manage Kawasaki disease, and we can manage this similarly. So it's not something to be terrified of because it's a rare side effect. So our children may be a little less likely to contract COVID. They may be a little less likely to be symptomatic. And if symptomatic, they're less likely to be severely ill. So this is great. This is great news. Now I'll tell you what we should worry about. The child could be a vector to your grandmother who lives in your home and is like me, but maybe even older and maybe even more frail. So the child could theoretically be a vector to a susceptible individual, an at-risk, vulnerable individual. Now, could that individual be a school worker who is in the cafeteria? And we don't go around asking people their private medical histories, but let's just presume the person has a bit of a weight problem and is diabetic. Well, that's two risk factors right there. Let's say we have a beloved teacher who nobody wants to see this person retired. In fact, the person's so vigorous, nobody even remembers that the person's 70 years old. But that person is at higher risk. So it's a little bit of a different way of thinking. We're very keen on controlling viral transmission in the children. Who wants a kid to get flu for the equivalent of a flu for 10 to 14 days? So we don't want our kids to get sick. If they do get sick, the worry is perhaps greater on whom they might infect. And if we can avoid the sort of intimacy of the children with the vulnerable, that would be a good thing. Not forever, just for these months in which we're trying desperately to control coronavirus. And if we stay very, very low in the state of Rhode Island or the state of Connecticut, as we intend to, then the risks are not so great for the vulnerable. But if we start to see a surge, if we introduce infection, and we do have some outbreaks in schools, I'm mostly worried about those vulnerable contacts. I think the kids will be fine.
That's so helpful. That's so reassuring for parents to hear. Courtney, what did we learn? What have we learned in reopening childcare that will help us to successfully reopen school?
So we've implemented a number of safety standards that I think will be the kinds of standards that parents should expect to see in school about limiting contacts, so not having kids mix. In childcare, we created small, stable groups. We have frequent cleaning, regular daily screening. This has been a tremendous amount of work because it's not how we typically operate, but it is possible. And we're demonstrating that when you put the work in, it is possible to do that. And we have to be prepared to respond because we know there will be positive cases. And if you put these safety precautions in place, when there are positive cases, the risk is mitigated. And we've been fortunate, as the governor said, we've had thousands of kids in childcare with thousands of teachers. We've had fewer than 24 cases across kids and teachers, and we've been able to respond appropriately enough to quarantine where appropriate, to test people, to clean, that it really reduces the potential for spread in a facility or in a school. And it allows us to feel like even when these positive cases occur, it won't be a widespread outbreak. And so we'll continue to build on those lessons, I think, for the school reopening and listen to the science. I know Commissioner Infante Green and Director Alexander Scott are talking 100 times a day, and that's what I had to do with Dr. Alexander Scott. We have to listen to doctors, and even though we're all afraid, I was afraid sending my daughter to summer camp, we can't rest in that fear. We've got to listen to the advice of the experts, understand the science, and then make sure that the protocols that we're implementing are aligned to what the science is recommending.
When you started, can you help us? You're in touch with a lot of the teachers and the child care centers. Are they more confident now? And just talk to us.
Yeah,
How were they at the beginning? How do they feel now? What are the things that we've done that has helped?
Yeah, I think parents and teachers at the beginning were really nervous, and we've seen parents slowly bring kids back. Providers have done some great things around creating videos so people know what to expect, and to educate parents. And we've done the same with teachers. We actually did professional development with thousands of early childhood educators about the science, about the standards, about what they should expect. And as time goes on, they're in small, stable groups. They see kids are being screened. Even in places where we see positive cases, they see us be able to respond and respond appropriately. I think the workforce feels more confident as time goes on because they know that we're paying attention and we're implementing the best practices. That said, it is hard, and I don't want to continue to not recognize that we are asking people to go above and beyond. And there's no question that we've asked groups of workers across the state to go beyond in our COVID response for many months. And we're asking that of early childhood educators who we don't pay enough, who we should pay more. For today, I can express gratitude. I can thank the governor for helping us increase rates to childcare facilities so that we are able to more properly reimburse people. But I also just want to acknowledge that this is another group of workers who are going above and beyond for all of us so that my child is safe and having an amazing camp experience. And there's really no amount of words that I could say to express the gratitude and what the impact on her life and the life of kids across the state will be if we are successful in achieving this goal of getting kids back to school.
That's great. Angelica, do we have you? No, we still don't have her. I'll keep going. Back to STEM. A challenge that we're having is there's so much noise, right? I mean, if you're a teacher sitting at home, your parents sitting at home, your students sitting at home. My daughter's in high school, my son's in middle school. You put the TV on, you look at social media, it's pretty easy to get caught up in the noise, get confused, fall into fear. So if there was something that you could tell Rhode Island that you think is getting lost in the noise around school and school safety and this whole discussion, what would that be?
The novel coronavirus washed over the world without any warning, really. China in December, the US and Europe in January, a surge in America in March. So it's understandable that people are scared of the thing. It's new, we don't know that much about it. I don't know, I've been doing infectious disease epidemiology for 40 years. This did not come as a surprise to us. We've been predicting a global pandemic respiratory threat for years, and we even had the warning of SARS. And in 2009, we had pandemic influenza. So There are 10 to 50,000 Americans who die of influenza every single year. 10,000 in a good year, 50,000 in a bad year. And life goes on. We recommend that you get vaccinated, and we recommend that you go to your doctor and consult very early and get the proper medications, and we can manage our lives. Well, we're almost there with coronavirus. We now have 3 reasonable drugs. One is a monoclonal antibody, a biologic intervention that helps modulate the immune system. One is a kind of weak antiviral, but it helps. And one is a steroid, which helps severely ill patients. So we're already in the treatment era, just a few months after we've discovered the doggone thing. So we're making progress. We also have drugs in the pipeline, and a lot of drugs in the pipeline. I've never seen it in my entire career. How many in clinical study at the present time. And I predict that there's going to be good news in September, and then there'll be some more good news in November, and then there'll be some more good news in February. So we are seeing the drug pipeline bringing in promising products, and some of them are going to work, and many of them will not work. So that's what we're doing in the clinical research enterprise, figuring out which ones work. So we're not going to be in this situation forever. We're going to be in a better place in 6 months, an even better place in 12 months. The vaccine may take a little longer. Optimists are saying by the end of the year. Realists are saying more like a year and a half from now. But the science so far suggests that several different products are promising. And I've done HIV vaccine research. I was doing it in the 1990s, and we've gone 40 years, and we're nowhere near an HIV vaccine. But coronavirus is easier. Looks like we are going to get there. So this is not a time of doom and gloom. It's not a time of paralysis by fear. The only thing we have to fear is fear itself. I heard that one before, FDR in a different context. But, you know, ultimately, I think we can treat this like flu. For one thing, all of us need an influenza vaccine. We don't need influenza on top of coronavirus. Everybody get a flu vaccine, no exceptions. Everybody get it. It's not a live attenuated vaccine. It's a killed product. It's, you know, and there are no contraindications. So, you know, virtually no. So go to your doctor, go to your pharmacy, get a flu vaccine. It's a good time to avoid the flu in the coronavirus season. The second thing I'd say is if you do have symptoms, call the doc quickly, try to get a test, find out if you've gotten coronavirus. You're going to take a bad cold or a mild flu more seriously this season than you would have last season, because it might be coronavirus. And we know coronavirus is more infectious. Because it's more infectious, we have to be more cautious. It's also more lethal, but it's lethal in a very special subgroup. It's more lethal in the elderly and in persons with prior conditions. And so it's a subset of people who are at especially high risk. The average person, the 3 of you on the call with me today, are not at particularly high risk. And if you get coronavirus, you'll do fine.
I think you were calling us young. That's what I just.
I was.
I just heard you called us young.
I was.
You hear that, ladies? I just want
That's right.
that to be
That's
stated for
right.
the record.
That's right.
Okay, just stick with me for a minute here. Take your infectious disease hat off, put your pediatrician hat on. What are the risks if we don't get the kids back to school? They're stuck in their bedrooms with doing distance learning. How do you think?
Well, I'm not going to tell your audience anything that they don't already know. School is a place where we learn to socialize. School is a place where we get exercise. School is a place where we have professional teachers, expert at their craft. It's a place where we learn how to live in society. So it's also a place that takes care of our children when we have to go to work. So there are a lot of really good reasons to have organized school. And sure, the occasional family is homeschooling. It's a tiny fraction of Americans who who see that as a viable option. So, you know, at school, you don't have to worry about your internet connectivity. You don't have to worry about the quality of your computer. You know, there's home learning is easier for the upper middle class that has a optimized sort of bandwidth reach from their internet and has an excellent computer. We've got plenty of people in the state of Rhode Island and Connecticut who are not so privileged. They don't have such great internet access, if any, and they may not have adequate. So it's a leveler, you know, coming to school, everybody gets the same. And I feel that you can do art, you can do music, you can do sports. Now, all of those are going to be modified. All of those are going to be different from an average year. We're going to be mitigating risk. We're going to be reducing risk with different strategies. And we can get into that, but probably don't have time. But the point is, that is my vote is that my kids are grown, but if they were school age, I would be happy to see them back at school as long as I felt that the school administration was watching out in a reasonable way to try to reduce their risk. And I would also be, I'd love to hear how they're going to reduce the risk of vulnerable teachers and vulnerable staff. So once I was satisfied with the kinds of answers I was getting at my PTA meeting, I'd be all for it.
Right. Am I back?
Yes, you're back.
Yes, and
Welcome.
we have time for one last question or two, so go ahead, Angelica.
Okay. So Director Hawkins, I think, you know, you've been heavily involved in the opening of schools, planning, but you've already done childcare and camps, summer camps. What's the one big lesson that you've learned throughout this process? You've done this, it's been successful. So what's the takeaway?
So I don't think there's anything I can teach you, Commissioner, but I would say observations. One, again, like trust in the science. We are all scared and we need to listen to experts. I think two, communication. Some of our best ideas have come from practitioners. And so for teachers and staff members who are worried and scared, help us find solutions, bring solutions to the table, help us achieve this goal. Some of our best innovations are from creative practitioners. And I think the third thing to remember is that kids are resilient. And I hear a lot of talk about, oh, kids can't operate in this way. And I'm here to tell you that they are. They are in small pods at camp now, where they're, you know, operating differently. They're getting dropped off at the door in their daycare center. People may have said to me, oh, my kid can't get dropped off at the door. She'll be too afraid. The providers have been able to work with families, and kids are resilient. And now it's like second nature and how we always operated. So I think we have to, as adults, remember that and challenge kids to come along with us on this journey to get back to school, because I believe that kids of all ages will step up and do it.
Encouraging.
I'd like to say one quick thing. I really liked what I heard about the participatory quality of the kids themselves. Let's recruit the kids to be our allies in coronavirus control. Kids can be so helpful. We can make masks fun. We can make them, you know, part of the whole experience. We can empower children to protect adults. We can have the children remind us to do the right thing. I think that is a great experiential learning opportunity that we're facing. Not every kid lives through a pandemic, and why not have them engage it, battle it, and be part of the solution?
Absolutely.
Thank you. I think on that optimistic and insightful note, we're going to have to call this discussion to an end. That was incredibly well said. I think that's right. You know, we have to look at the opportunities in all of this to be innovative. I have said for Rhode Island, let's come out of the crisis stronger, more innovative, more equal, more resilient than we went into it. And so if we harness the problem-solving power of kids, we're going to be that much more successful. Anyway, I cannot thank you enough, Dr. Berman. You're a busy guy and your expertise is in demand. So thank you. Thank you, Courtney. And of course, as always, thank you to the Commissioner.
Thank you, Governor.
Thank you, Governor.
Bye-bye. Have a good day.
don't transmit very easily. So shouldn't we figure out which one of those it is before kids go back to school?
So let me give you two answers to this. First, I would point you to CDC guidelines that said based on current data, the rate of infection among younger school children and from students to teachers has been low, especially if proper precautions are followed. There have also been few reports of children being the primary source of COVID-19 transmission among family members. That's where the data currently stands. But that being said, even if there is transmission and later studies come out, let's say, we believe that students should be going back to school because the effect on a child, we know scientifically, they are not affected in the same way as an adult. Again, I'd point you to CDC guidelines on this that says the best available evidence indicates if children become infected, they are far less likely to suffer severe symptoms. Death rates among school-age children are much lower than among adults and far lower than during the H1N1 pandemic, for instance, when schools remained open.
Yeah, and Dr. Brooks noted that today, unless kids have an underlying condition, but she said they do not know how rapidly they can spread it still if they're under 10. And that's one of the president's top advisories.
So on the transmission point, I point you again to the CDC, but I would also say that it is our firm belief that our schools are essential places of business, if you will, that our teachers are essential personnel. You all here are considered essential workers, which is why you were coming into the briefing room every day during the pandemic. Our meat packers were meat packing because they were essential workers. Our doctors were out there treating because they're essential workers. And we believe our teachers are essential. Particularly, I pour over the data on schools often. And the one thing that really stuck out to me, I read through the entirety of the CDC guidelines, was that I talk about child abuse often and 1 in 5 cases being reported in schools. Well, the CDC guidelines went on to say there has not just been a sharp decline in reports of suspected maltreatment, but tragically a notable increase in evidence of child abuse when children are seen for services during the pandemic. For example, in Washington, D.C., Child and Family Services Agency recorded a 62% decrease in child abuse reporting calls between mid-March and April compared to the same time period in 2019, but saw more severe presentation of child abuse cases in emergency rooms. That's a tragedy, and our schools must reopen.
Okay, my question was about transmission rates. But anyway, my second question is also
And I
on the
answered that.
president's call with the Russian president yesterday. Today, the nation's top counterintelligence official said that Russia is one of 3 countries that is actively working to interfere in our election. Did the president bring up election interference on the call with the Russian president yesterday?
Again, I wasn't on the call, but the president, I was not on the call. The president has taken more actions for election security than his predecessor, who gave a stand down order when he learned about election interference. Susan Rice gave that stand down order. Obama's intel chief even confirmed that stand down order was given. By contrast, we've given a ton of funding to election security. We take our election seriously, and we believe in election integrity.
My question is, did President Trump bring it up on the call?
Justin, I was not on the call, Caitlin. Stop filibustering. Justin, let your colleagues ask questions. Justin, okay, Justin no longer has a question. Anyone else?
Kaylee,
Okay.
around 20 million Americans.
Kaylee, the president's tone on the virus this week seems to have changed. He's advocated a few different times for Americans to wear masks. He said that the pandemic would get worse before it gets better. He canceled most of the convention, or certainly the Florida part, yesterday. All of these things were bad 2 months ago, even longer than that. And the science on masking has been clear for several months. What changed this week? Why did his tone change?
There has been no change. The president said on March 31st, before there was even a recommended but not required guidance given by the CDC on mask wearing, the president already said, if you want to wear a mask. It doesn't harm anyone. And that was when our scientists even were, some of them were saying, don't wear masks. So the president has been consistent on this. He wore a mask back at the Ford facility. He carries around in his pocket. He showed it to you multiple times. He hasn't changed. In fact, and just speaking on COVID generally, the way I've heard him talk privately in the Oval Office is the way he's talking out here. The only thing that changed is the president taking dozens and dozens of your questions each and every day, because he felt the best way to get information to the American people was for him to be out here answering your questions and providing this directly.
The other part of the question, though, wasn't just about masking, although I would argue that if you look back and see when he called it politically correct, for example, that wasn't exactly agreeing with the science of wearing masks. But setting that aside,
No, but let's not set that aside, because in that incident, when he used the words politically correct, it was in reference, I believe you were asking him a question, was it? And right, and you were standing outside and you'd been tested and you were wearing a mask and he couldn't hear your question. So he asked for you momentarily to pull down the mask. So that was the specific context, and context does matter here.
Okay, well, I didn't need to engage on that, but I was standing around other reporters and using the same mic that other people were using. That's why I left my mask on.
Right. Well, he could not hear your question. He asked for you temporarily to pull it down. Everyone in the press pool's tested. So scientifically, you were not in a compromising position, but he hasn't changed his tone. But this president, the reason he wants to bring back these briefings is to get information out there. Like, we've done 52.9 million tests nationwide, 187 emergency use authorizations authorizations, for test manufacturing, 20 million swabs per month, use the DPA over 20 times. All of these great successes of this administration, like distributing 31,000 cases of remdesivir, enough to treat nearly 200,000 patients. None of this is getting covered. And you've got the best messenger, the duly elected president of the United States, talking directly to the American people and getting extraordinary ratings as they tune in to get information from their leaders.
Question wasn't about
John.
that last piece. I just want to clarify one thing, Kaylee.
Okay, John no longer has a question. Anyone else?
I just want to clarify.
I don't want to talk over it. If you don't mind, Jeff, maybe we can come back to you.
I would like to finish my question.
Yeah. Well,
Yeah, but
let
when
me ask my
everyone in the
question.
front rows get 5 questions, people in the back row don't even get the opportunity to ask questions.
You're not answering the question.
I want to ask about the Senate Defense Authorization Bill, which passed by a veto-proof majority yesterday, and the House earlier this week also passed their version of the defense bill, also by a veto-proof majority. And both of those bills contain mandates that the Pentagon rename these military bases, which are named in honor of Confederate generals. I want to ask you, does the president believe that his position, which we're all familiar with, it's helpful in terms of recruitment, specifically for African Americans? Explain how that position will help recruit African Americans in an all-volunteer military force.
The president stands with the American people. 56% don't want to see the bases names changed. Where he stands is in a place where many soldiers who have lost their lives overseas, the last ground that they saw were these bases. And by changing their names, he believes that it is not appropriate that those soldiers who lost their lives to be told that the ground that they
familiar with
left.
his position, and you just restated it very well, but I'm asking you specifically, how is this helpful for an African American who wants to volunteer for our all volunteer military forces to go to a base that's named for a Confederate general that worked to still put and keep in place slavery, which impacted their ancestors?
Because the bases are not known for the generals they're named after. The bases are known for the heroes within it, the great Americans, Black, white, Hispanic, of every race who have died on behalf of this great country. And 56% of the nation agrees with the president.
Your position that
Yes.
it won't impact
Yes.
it won't impact in any way recruitment is what your position is.
Next question.
Is
I've
that a
already
yes
answered that
or
one
no?
twice.
It's just a yes or no.
Kaylee, first of all, has President Trump determined where he's going to or how he's going to deliver his speech? He said he was working on that yesterday.
So he hasn't decided that just yet, but we have a number of really creative, exciting options that he's looking at. It's a question more for the RNC, but he's very excited about the prospect of what will come with the convention.
And I want to ask you about something that he tweeted back in April. He said Joe Biden wanted the date for the Democratic National Convention moved to a later time period. Now he wants a virtual convention, one where he doesn't have to show up. Gee, I wonder why. Does the president regret that now?
Well, as you know, I can't respond to Joe Biden. You'd have to ask the campaign about that. But the circumstances changed in Florida where we intended to have the convention. As the circumstances on the ground changed, the president changed his viewpoint on having the convention in Jacksonville at that particular location.
I wanted to ask you about the president's phone call with Vladimir Putin. Did the president raise the issue of Russian bounties on the lives of American troops during that phone call?
So as you know, that intelligence is unverified still to this day. There are dissenting opinions within the intel community. I won't get into the president's private discussions with a foreign leader. I was not on that call, but that intelligence is still unverified. But rest assured, our president will always stand with our military and protect them against any and every foreign adversary.
Determination failure about what happened. He's been briefed now, right?
Yes, thank you.
Thank you.
Yes, Nancy Pelosi and Mitch McConnell announced that John Lewis
I'll come back to you next.
will be lying in state at the Capitol Monday and Tuesday. Does the president plan to go to the Capitol to visit John Lewis on one of those days?
I have no announcements about the president's upcoming plans, but John Lewis was a civil rights icon. We lowered the flag at the White House here to signify that. So I have no future announcements of the president's plans other than to take our election seriously, and we believe in election integrity.
My question is, did President Trump bring it up on the call?
Justin, I was not on the call, Caitlin. Stop filibustering. Justin, let your colleagues ask questions. Justin, okay, Justin no longer has a question. Anyone else?
Kaylee.
Okay.
Question wasn't about
John.
that last piece. I just
Thank
want to
you.
clarify one thing, Kaylee.
Okay, John no longer has a
No,
question.
I do.
Anyone
I
else?
do.
I just want to clarify.
I don't want to talk over it. If you don't mind, Jeff, maybe we can come back to you.
I would like to finish my question.
Yeah. Well,
Yeah, but
let me
when
ask my
everyone in the
question.
front rows get 5
Position
questions.
that
Yes.
it won't impact in any way recruitment is what your position is.
Next question.
Is
I've
that a
already answered
yes
that
or
one
no?
twice.
It's just a yes or no.
I have 2 questions for you. This morning, Dr. Burke said that it is still an open question how rapidly children under 10 can actually spread COVID-19. But the other day, the president said they don't bring it home very easily and they don't transmit very easily. So shouldn't we figure out which one of those it is before kids go back to school?
So let me give you two answers to this. First, I would point you to CDC guidelines that said based on current data, the rate of infection among younger school children and from students to teachers has been low, especially if proper precautions are followed. There have also been few reports of children being the primary source of COVID-19 transmission among family members. That's where the data currently stands. But that being said, even if there is transmission and later studies come out, let's say, we believe that students should be going back to school because the effect on a child, we know scientifically, they are not affected in the same way as an adult. Again, I'd point you to CDC guidelines on this that says the best available evidence indicates if children become infected, they are far less likely to suffer severe symptoms. Death rates among school-age children are much lower than among adults and far lower than during the H1N1 pandemic, for instance, when schools remained open.
Yeah, and Dr. Brooks knows that today, unless kids have an underlying condition, but she said they do not know how rapidly they can spread it still if they're under 10. And that's one of the president's top advisories.
So on the transmission point, I point you again to the CDC